Hello friends, so in this video we are going to see about the immediate newborn care, which is to safeguard the baby after delivery and to help the baby to have the transition from intrauterine to the extrauterine environment. So this immediate newborn care is also a part of nursing care, and the nurses should be so vigilant and very careful in handling the newborn babies, especially when assessing the UPGA score and receiving the baby, placing the baby, and handing over the baby to the mother for the breastfeeding purpose. And there are several areas where we have to be more conscious about handling the freshly born baby. So the if you talk about the normal newborn care aspects, so it is most important because it helps to have the normal bonding process also between the mother and the baby, especially then later with the family members, and it also helps the baby to have normal growth and development in the continuous stages of life. So in order to provide and achieve all these things, so the care aspects are divided into two mainly. One is immediate newborn care and essential newborn care, right? So let us see in this video only about the immediate newborn care, and the essential newborn care video will be shared later. So immediate newborn care, we have four main aspects. One is establishment and maintenance of respiration, stabilization and maintenance of body temperature, prevention of infection and injury, provision of optimal nutrition. These four are the important areas where we are going to focus in order to provide immediate newborn care. Let us see one by one. So let's start with establishment and maintenance of respiration. How we are going to achieve this is we have to see the quality of cry the baby have immediately after birth, right? Because it is well said that the crying baby is a healthy baby and the crying baby is a breathing baby as well. So failure to cry may be due to obstruction of the air passages by mucus that has to be cleaned off. So this can be done in two areas. One is the oropharynx and the nasopharynx. Okay, this can be sectioned with the bulb syringe, or sometimes the catheter can be connected to the section as soon as the head is delivered. So this process will help the baby to establish and maintain the respiration. So this is a simple device called bulb syringe that we are using to remove the mucus from oropharynx as well as from the nasopharynx. So what we have to do is we have to wipe mouth and nose of secretions after delivery of the head, and we have to compress the bulb syringe before inserting. This is the mechanism how to use that simple device, and we have to suction mouth first, then the nose. This is the order of using this device, and insert bulb syringe in one side of the mouth only, right? So as I mentioned earlier, a crying baby is a breathing baby. So what we have to do is stimulate the baby to cry if baby does not cry spontaneously or if the cry is very big. So in both cases it is applicable. We have to stimulate the baby in order to start or establish the respiration. So we should not slap the buttocks, rather we can rub vigorously the soles of the feet. That can help us to initiate the respiratory pattern in the newborn, and stimulate to cry after secretions are removed. That is more important. Then the normal infant cry is loud and husky. So this is the indication that the baby has started spontaneous respiration. And we have to look for some abnormalities also in terms of cry. If it is a high pitched cry, then it indicates the baby may have hypoglycemia, increased intracranial pressure, or always in preterm babies weak cry is evident. That is obvious that the premature, because of the prematurity, the preterm babies will have weak cry. And if it is a hoarse cry, then the laryngeal stridor is expected. These are some abnormalities also. So cry also has some qualities, and it gives some hints to the nurses that we can identify some of the issues in well in advance to take care of the baby. So these two are the techniques in order to stimulate the newborn baby to breathe if the spontaneous respiration is not established. So once we can vigorously rub the infant's back, and you have to understand that buttocks should not be touched in this case. And we have to flick the soles of the feet. So these two processes can be handled, or we can apply these two techniques in order to establish the or to stimulate the spontaneous respiration in newborn. So if the neonate is apneic, or there is no breathing, cessation of breathing is found, or has gasping respiration near to the terminal stage of respiratory pattern, what we have to do is we have to start immediately positive pressure ventilation, and the heart rate also we have to assess. That can be assessed by grasping the base of the card or by auscultating the left chest with the stethoscope. This can be done. And keep in mind that it should be greater than 100 beats per minute. This also helps to score the Apgar. And the newborn's tongue and lips should be pink. So if it is blue or something, any other pallor or something, that has to be notified. Then acrocyanosis is a normal finding. So this is um, bluish discoloration of the simultaneous occurrence of the bluish discoloration of the extremity, that is acrocyanosis. We have to consider this a normal characteristics of the newborn. And we should remember that if the respiration is not established spontaneously, there are reasons. Maybe the neonate is having or suffering from asphyxia or hypoxia. So what are these two conditions? If an infant fails to establish adequate sustained respiration after birth, the infant is said to have neonatal asphyxia. So hypoxia is defined as too little oxygen in the cells of the body. So it can occur in the fetus or newborn. Now that is before delivery or after delivery. Both are possible. So if the placenta fails to provide the fetus with enough oxygen, hypoxia will result, and it causes fetal distress when the fetus is inside the uterus. It is an intrauterine life itself. Similarly, with failure to breathe well after delivery, the newborn will develop hypoxia, that is after delivery once the baby is born in the extrauterine environment, right? So as a result, heart rate falls, central cyanosis develops, and the baby becomes hypotonic and unresponsive. So these are the signs you can see when you're doing Apgar score assessment. So these are the outcomes. If the baby is having the score of less than 7 or 5 or 3 or 4 somewhere, so these manifestations can be seen in Apgar score assessment. Yes, so just we are moving to the next stage of this immediate newborn care. This is called as a Apgar score. So this is the very first test we are applying on the baby in order to rule out the baby's condition, whether the baby has started spontaneous respiration, how the muscle tone is, and the reflexes about, and the activity of the baby, and the skin color of the baby. So there are 5 parameters that we are going to see in the Apgar score, and this is the scoring system developed by Dr. Virginia Apgar. He was an anesthesiologist, and it was developed in the year 1952. So there are 5 parameters that we are going to see while assessing the baby for Apgar system, Apgar assessment. One is appearance, that is nothing but skin color we are going to see. Sometimes it is bluish, paler, or sometimes it is completely pink from top to bottom. Then pulse rate we are going to see, reflex activities we are going to see, and the muscle tone, either it is hypertonic or hypotonic. Then the respiratory effort of the baby, right? That depends on the quality of the cry that can be identified. So if you talk about the frequency of conducting this test, so 2 times we can administer this test in order to know the variations in the APGAR scoring. Immediately after birth, the first minute we are assessing, then after 5 minutes. So we have to compare the scores between the first minute and the 5 minute score, and we have to come to the conclusion, is there any variations, whether it is low, still it remains same, or any changes in the scoring system which needs some immediate attention or interventions in order to save the baby, right? And in rare cases sometimes it goes up to 10 minutes also, and we have to repeat the assessment several times, and according to the recommendations given by American Academy of Pediatrics, up to 20 minutes also these can be repeated if the score is 7 or less than 7, right? And especially when the 5 minute score is less than 7, this has to be repeated every 5 minutes up to 20 minutes. Okay, so the 5 criteria scoring is given like this. The minimum score is 0 and the maximum score is 2, and the criteria are 5, so total score will be going to be 10. So this picture depicts about the 5 parameters, and the score 2, score 1, score 0. When score 2 is given, we talk about the appearance. If the body is completely pink in color, and the pulse rate is more than 100 beats per minute, and the cry is good and it pulls away, then the activity is found very active and the cry is very strong. In that case, all the criteria is going to get the score of 2 and the final score will be 10 out of 10. And the further score 1 means the baby is going to get 5 out of 10, and the score 0 in the sense 0 out of 10 the baby is going to score it. So this is how we are going to assess the ABGAR score. And the interpretation of the scoring system will be like this: total score is 10 and no depression, which means there is no respiratory depression. In the sense, the baby must have the score between 7 to 10. If it is less than 7 and between 4 to 6, it shows somewhere the baby is having mild respiratory depression. And again, if it is between 0 to 3, it indicates severe depression. In that case, resuscitation process should be initiated immediately without any delay. And there are some causes why the newborn gets low ABGAR score even at 1 minute or 5 minutes. One is fetal distress due to hypoxia before delivery, and if it is a preterm baby, it is obviously you're going to see very less score in the ABGAR, and difficult or traumatic delivery process and a severe respiratory distress. These are the common causes, and all newborns with a 1 minute ABGAR score below 7 require resuscitation. If simulation, positioning, suctioning fail to start breathing, the infant needs mask ventilation, intubation ventilation, and the chest compression. These are the corrective measures or the immediate interventions we have to adopt in order to save the baby. So the second aspect of immediate newborn care is stabilization and maintenance of body temperature or thermoregulation. In simple terms, we can say. So the temperature of newborn usually drops immediately after birth because the system gets adjusted with the extrauterine environment. It may takes time. So immediately you can see falling or drop in the temperature, and it is the responsibility of the nurse to stabilize and maintain neonate body temperature by achieving the balance between heat production and the heat loss. So we must understand as a nurse how heat production happens and how heat loss occurs. So if you know this process, it is easy to maintain the balance between these two. So to understand the heat production, you should know about brown fat. What is brown fat? So it is a type of fat present in newborns and very rarely found in adults. It is a unique source of heat energy for the infant because it has greater thermogenic activity than ordinary fat. So it is called brown fat, and you can see in the newborn's body somewhere, that is kidneys, neck, and upper chest. These are the areas this brown fat is deposited, and the main function of this is it is a source of heat energy, which means heat production. It helps to maintain the thermoregulation of the baby, so it is called brown fat. So you can see in this picture, these are the areas where you can find the presence of or the deposition of brown fat in newborn. And you should know equally about the heat loss. So it happens in four ways: evaporation, radiation, conduction, and convection. So let us see first about evaporation. What is evaporation? So at birth, amniotic fluid which covers the body of the newborn evaporates, resulting in a body heat loss. So immediately when the baby is born, this fluid will be removed, and that initiates the heat loss process. So this can be prevented by drying the hair and the skin with warm, soft and dry towels, and placing the baby on the mother's body by wrapping the neonate in blankets, or by putting the neonate into heated environments such as the radiant warmer. So, and bathing should not be done until the temperature is normal and stable. If we do all these processes, we can save the baby from evaporation process. And how radiation occurs: when the newborn is placed in a crib near a cold wall, window, or air conditioner, heat will be lost. That process is called radiation. And the conduction is if the neonate is placed on a cold surface during examination, either you're taking the baby for physical examination or vital signs assessment, and such a process that may leads to um, loss of body heat by conduction. And placing the neonate in direct contact with the cold air or air currents increases the heat loss by convection. Okay, these four are the methods where the baby is going to lose the body heat, and nurses must be very clear in these four aspects that we should not leave the baby for this under these four processes, that we have to protect the baby from this heat loss methods. So this picture shows about how these four methods of heat loss happens in the newborn. So the nurse must attempt to maintain the temperature within a normal range, that is between 36.5 to 37.5 degrees Celsius, rectally for normal or large newborns, and 35 to 36.5 Celsius for the children who weight 1500 gram or less at birth. Okay, that is low birth weight baby. So the newborn can be dressed in a shirt and diaper and covered with the blankets as needed in order to protect the baby from heat loss. And the head can be covered with the cap and the foot with booties if heat loss is a problem. So this is always advised to the parents, if especially when the mother is a primary mother, we have to advise them. We have to give them education regarding how to protect the baby from heat loss. And the third criteria or third aspect of immediate newborn care is prevention of infection and injury. This can be achieved by several other sub areas. One is identification of the baby, eye care, vitamin K administration, hepatitis B vaccine administration, bathing, care of the umbilicus, and circumcision. Let us see one by one. So it is the most important area, identification. It starts right from the birth of the baby. Okay, what we have to do is we have to tie the identifying bands. So that has to be secured fastened and verify the information such as name should be there, gender of the baby should be mentioned, and mother's admission number should be there, date and time of birth against the birth records. And nowadays, because of the advancement in technology, electronic tags that give of a radio frequency may also be used, because this is mainly help us to prevent the newborn abductions, because this is the most common problem what we are facing in all mass medias and everywhere. You can see the newborn abductions are more common nowadays. So this is an example how the identification band will be there. The details also mentioned in this. And next is eye care. So if you talk about eye care, prophylactic eye treatment against ophthalmia neonatorum, infectious conjunctivitis of the newborn, it includes, we have to administer silver nitrate 1% solution, erythromycin 0.5% and tetracycline 1%. And sometimes 14-day course of oral erythromycin also can be given, or an oral sulfonamide may be given for chlamydia conjunctivitis if it is evident. Yes, most important aspect of this is immediate newborn care is administration of vitamin K, because we know that this vitamin K is needed for blood clots and to stop bleeding and to prevent vitamin K deficiency bleeding disorder, that is VKDB in short we can say, because this can lead to brain damage and death, especially in the newborns within the first 6 months, right? So vitamin K is synthesized by the intestinal flora. The infant's intestine is sterile at birth and the breast milk is low in vitamin K. So in this case, we have to administer vitamin K immediately after birth within first 6 hours to prevent all these problems. So what the American Academy of Pediatrics recommends that all newborns, whether breastfed or formula fed, receive a one-time intramuscular shot, that is administered through vastus lateralis muscle, and the dosage is zero point 0.5 to 1 milligram within 6 hours after birth. This is the recommendation given by AAP. Okay, so if we do so, we can prevent the baby from VKDB, that is vitamin K deficiency bleeding disorder. And regarding hepatitis B vaccine administration, this is also important mainly to prevent the consequences of cirrhosis and liver cancer in the adulthood. The first of 3 doses of hepatitis B vaccine is recommended soon after birth and before the hospital discharge. Okay, this is also highly recommended for the children. So if you talk about bathing, bathing is usually performed after the vital signs have stabilized, because otherwise it may alter the vital signs of the baby, especially the temperature, body temperature. So nurses should wear gloves when handling the newborn until blood and amniotic fluids are removed by bathing. And frequently, normal variations such as Epstein purles, Mongolian spots, and stork bites cause parents much worry because they are unaware of the significance of such findings. These are the normal characteristics that we have to make them understand, especially the parents. Also, one of the most important considerations in skin cleansing is preservation of the skin's acid mantle. What it is a special mechanism the child has. The infant's skin surface has a pH of about 5 soon after birth, and the bacteriostatic effect of this pH are significant. And if we give bath immediately, this will remove away this acid mantle, and the protection factor is will be removed if you are starting the bathing process immediately. Okay. So consequently, only plain warm water or soap with appropriate pH should be used for the bath. And if the parents or the mother is using alkaline soaps, oils, powder and lotions are not used because they alter the acid mantle, thus providing a medium for bacterial growth. So the bacteriostatic effect will be removed if these products are used to give bath to the baby. That's why it is highly not recommended or advised. And how to take care of the umbilicus. After delivery, the umbilical cord is either clamped or tied before the cord is cut. And the umbilical cord stump will change from bluish white to black as it dries out and eventually falls off. That is mainly to once the cord is cut and it lacks of blood supply, blood circulation, it will become the gangrene formation will be there and it will become very dark in color. Okay, the car stump develops dry gangrene and falls off between 7 and 10 days after birth. So within a week, it is expected to fall down. So the area should be washed gently with water and mild soap and dried well. So we have to teach the parents regarding the care of the cord and the possible problems that may arise and any indications of infection around the umbilical such as reddened area or a foul discharge should be reported immediately. And the other aspect is about the circumcision. So if there is a problem in this uh, foreskin of the glans penis, then it can be removed surgically. That process is called circumcision. And the final aspect of this immediate newborn care is provision of optimal nutrition. It is nothing but feeding the baby through breast milk. Right? So selection of a feeding method is one of the major decisions faced by parents. In general, there are three acceptable choices are there. One is the baby can be fed with the mother milk, breast milk or human milk. Second is where the mother is not available or if the mother is diagnosed with some kind of infectious diseases, commercially prepared whole cow's milk formula can be given or they can go for modified evaporated cow's milk. So these are the options the parents have, they can feed the children. So in this way they can suffice the nutritional pattern of the baby. So these are the most important aspects of immediate newborn care. Thank you for watching.